You're looking at my hip. When I was a kid, I was diagnosed with something called Legg-Calvé-Perthes disease. Basically, they told me it was Bo-Jackson syndrome. The blood supply was cut off to my hip bone and the bone started to collapse. It changed my childhood. It limited what I could do in sports, how I moved, and honestly, it shaped the rest of my life. And you know what advice I heard most often? Don't worry, you'll grow out of it. But I didn't. I actually grew into it. And that's why I feel so strongly about helping kids today get more than generic advice. Kids deserve real answers and a real plan. So let's look at 5 key areas. Number 1, why generic advice fails kids. When a child is in pain, struggling with posture, or having repeat issues, telling parents to wait and see doesn't cut it. That was my story. And waiting never fixed the problem. It just made the road harder. Number 2, the importance of a whole child evaluation. Because kids aren't mini adults. Their bodies are developing fast, and every part of growth connects. A whole child evaluation looks beyond the symptom like knee pain or slouching and asks what's really happening with posture, sleep, movement, and nervous system function. No one ever looked at my growth patterns as a kid. They just told me to rest. And that left a lot of missed opportunities to actually help. Number 3, the right plan supports recovery and growth. So quick fixes don't create long-term results, but the right plan builds a strong foundation so a child not only recovers, but grows stronger in the future. If I had a structured plan early on, my journey could have looked very different. That's why in our clinic, every child gets a personalized plan, not just a pat on the back. Number 4, some real stories to share. I've seen families walk through our doors after months or even years of hearing, hey, just wait it out. And the difference when they finally get real answers is incredible. Ear infections stop. Kids start sleeping better. Posture improves. Sports performance comes back. Parents go from stressed and worried to confident and hopeful. And I know how powerful that is because I wish my parents had the same clarity when I was a kid. And lastly, number 5, steps to finding care that you can trust. So how do you find care that actually works? Well, look for someone trained in pediatric care. Find a provider who listens, explains clearly, and builds a plan around your child's needs. This isn't about rushing through an appointment. It's about partnership. It's about trust. And it's about making sure parents never leave the office guessing what comes next. I grew up with a condition that shaped every part of my life. And I know what it's like to feel like you're just waiting and hoping. That's why I've committed my career to helping families avoid the same frustration. Your child deserves more than wait and see. They deserve real answers, a clear plan, and a chance to grow up healthy and strong. So don't hesitate to book your $69 pediatric evaluation today. Don't guess, don't wait. Take that first step and give your child the care they deserve. And once your child is feeling better, the next question is, how do we keep them there? That's exactly what I'll cover in the next video. How to stay strong, aligned, and out of pain once you're feeling better. I'll see you there.